Understanding migraines, causes, symptoms, and management. Migraines are a complex and debilitating neurological condition that affects millions of people worldwide. Unlike a typical headache, migraines are characterized by intense throbbing pain, often accompanied by other symptoms, such as nausea, sensitivity to light and sound, and visual disturbances. In this video, we will delve into the causes, symptoms, and management of migraines to provide a comprehensive understanding of this condition. Migraines are a diverse group of neurological disorders that can manifest in various ways. The International Headache Society, IHS, has classified migraines into several types based on specific characteristics and symptoms. Here are some common types of migraines. Migraine without aura, common migraine. This is the most prevalent type of migraine, accounting for the majority of cases. Individuals with this type experience moderate to severe headache pain that is usually accompanied by other symptoms, such as nausea, sensitivity to light and sound, and, in some cases, vomiting. Unlike migraines with aura, there are no specific warning signs, auras, before the onset of the headache. Migraine with aura. Auras are sensory disturbances that precede or accompany the headache phase in some migraine sufferers. These disturbances can affect vision, hearing, or other senses. Visual disturbances are the most common and can include seeing flashing lights, zigzag lines, or temporary vision loss. Auras typically last for 20 minutes to an hour and are followed by the headache phase. Chronic migraine. Chronic migraines are diagnosed when a person experiences a headache on 15 or more days per month for at least 3 months. And at least 8 of those headaches are migraines. Chronic migraines can significantly impact daily life and often require a combination medications for management. Menstrual migraine. Some women experience migraines that are closely linked to their menstrual cycles. These migraines often occur in the days leading up to, during, or right after menstruation. Hormonal changes, particularly fluctuations in estrogen levels, are believed to contribute to the onset of menstrual migraines. Vestibular migraine. Vestibular migraines are characterized by dizziness and problems with balance, often accompanied by other migraine symptoms. Individuals with vestibular migraines may experience vertigo, unsteadiness, and difficulty with coordination. These symptoms can occur with or without a headache. Ocular migraine, retinal migraine. Ocular migraines involve temporary vision loss or visual disturbances in one eye. These symptoms can include seeing flashing lights, blind spots, or zigzag patterns. Ocular migraines are usually short-lived, with vision returning to normal after the episode. Status migrainosus. This is a rare and severe form of migraine that lasts for more than 72 hours. Status migrainosus can be particularly challenging to manage, and often requires medical intervention in a healthcare setting. Acephalgic migraine, silent migraine. Acephalgic migraines are characterized by the presence of aura symptoms without the typical headache phase. Individuals may experience visual disturbances or other aura symptoms without the severe headache that usually accompanies migraines. It's important to note that the classification and understanding of migraines are continually evolving, as researchers gain more insights into the underlying mechanisms of these headaches. Individuals experiencing migraines should seek medical advice for an accurate diagnosis and appropriate treatment plan tailored to their specific type of migraine. Causes of migraines. Genetic factors. Migraines often run in families, suggesting a genetic predisposition to the condition. Certain genes have been identified that may increase the likelihood of experiencing migraines. Neurological triggers. Migraines are thought to involve changes in the brainstem and its interactions with the trigeminal nerve, a major pain pathway. Abnormalities in the brain's neurotransmitters, such as serotonin, may also contribute to the onset of migraines. Hormonal changes. Fluctuations in estrogen, particularly in women, have been linked to migraines. This is evident in the fact that many women experience migraines around the time of their menstrual cycles. Environmental factors. Certain environmental factors can trigger migraines in susceptible individuals. These may include bright lights, loud noises, strong odors, and changes in weather. Lifestyle factors. Irregular sleep patterns, dehydration, and high stress levels can contribute to the development of migraines. Identifying and managing these lifestyle factors can be crucial in migraine prevention. Symptoms of migraines. Throbbing pain. The hallmark symptom of migraines is a throbbing or pulsating pain, usually on one side of the head. This pain can be severe and debilitating, often lasting for hours to days. Aura. Some individuals experience visual disturbances known as auras before the onset of a migraine. Auras may include flashing lights, zigzag lines, or temporary vision loss. Sensory sensitivity. Sensitivity to light, photophobia, sound, phonophobia, and sometimes even touch is common during a migraine attack. Individuals may seek a dark, quiet room to alleviate these symptoms. Nausea and vomiting. Many migraine sufferers experience nausea and vomiting during an attack. This can further contribute to the overall discomfort and debilitation associated with migraines. Diagnosis and treatment. Diagnosis. Diagnosing migraines involves a thorough medical history, a detailed description of symptoms, and sometimes imaging tests to rule out other underlying causes. Keeping a migraine diary can help track triggers and patterns. Acute treatment. Medications such as triptans and non-steroidal anti-inflammatory drugs, NSAIDs, are commonly used for acute migraine relief. Anti-nausea medications may also be prescribed. Preventive measures. For individuals with frequent or severe migraines, preventive medications may be recommended. These can include beta blockers, anticonvulsants, and certain antidepressants. Lifestyle changes. Lifestyle modifications play a crucial role in managing migraines. This includes maintaining regular sleep patterns, staying hydrated, managing stress through relaxation techniques, and avoiding known triggers. Coping strategies. Identifying triggers. Understanding personal triggers can empower individuals to make lifestyle changes. It reduces the frequency and severity of migraines. Stress management. Stress is a common trigger for migraines. Techniques such as deep breathing, meditation, and yoga can be effective in managing stress and preventing migraines. Biofeedback and cognitive behavioral therapy. These therapeutic approaches can help individuals gain better control over physiological processes and learn coping mechanisms to reduce the impact of migraines. Migraines are a complex neurological condition with a range of genetic, environmental, and lifestyle factors contributing to their onset. Seeking professional medical advice and developing an individualized treatment plan are essential steps in effectively managing this condition.